Coming to you from that once-forgotten artery that pulses through the center of the continental United States and into the heart of the Ozarks, Grace Matthews. Looking in from the northern border, our Canadian friend, along with his countrymen feeling the effects of U.S. political issues, Connor Murphy.
Welcome to Dueling Dialogues, episode 206. I'm Connor Murphy here with Grace Matthews. Hi, Grace. How you doing?
Oh, my gosh. I've already got cabin fever, and it's like zombie world.
Yeah, it's pretty weird, isn't it?
It is. It's like, I've never liked those zombie movies, but kids like them, but everything is like that.
Yeah.
You leave your house, and people are driving like, your great-grandmother.
Yeah.
You go in places and everybody is so standoffish, understandably, from each other, that it's like zombie land.
Yeah, it's a bit insane out there. Same thing going on in Canada, pretty much. Yeah.
Absolutely.
Yeah. Are the U.S. citizens buying up all the toilet paper as well?
Oh, yeah. And they're gouging. I had to get out this morning because we're kind of just trying to stay ahead of things, trying not to hoard. Right. I don't think hoarding is fair, but we're trying to stay, 2 weeks ahead on everything. So we got a little worried this morning. Okay, we normally go do a Walmart shopping trip early on Sunday mornings.
Right.
That's just kind of always been our thing. We both go, show that we get what we want or need, and we don't go back 100 times a week. Right. We live in Walmart land. I know people that stop there every day. I can't imagine, Bert.
Wow.
We used to only go once a month.
Yeah. Normally I just wait in the car.
Yeah, I get that too. I get that. I went several years without going to Walmart. I just used other places, but that's another story for another day. But anyway, so today we start thinking, they have this stuff on Sunday. Why don't you go ahead and go? We need laundry stuff, and people are buying this cleaning stuff. So I go there, and first of all, it's very empty, which is okay with me. But there's no paper products whatsoever. I kind of wanted to get some extra paper towels. If they had toilet paper, I'd buy some more. So they came out with a pallet of toilet paper, and they just started basically throwing it to people who were around.
Unbelievable.
So I took one, and I had no idea how much it was, of course, And Walmart is not supposed to be gouging.
No.
So anyway, before I go to the register, I start to hear this guy having a meltdown in the toilet paper aisle. He's like screaming. And I'm like, I don't know if he's got a weapon, so I'm just going to hightail it. I got pretty much what I need, I get up there and ring up this thing of toilet paper, $12.58.
Wow.
Yeah.
Okay.
That's a lot more than I pay for toilet paper normally.
That doesn't sound too
I pay about
outrageous.
half that.
Not outrageous for Canada.
Well, not a Canadian, but I'm sure a lot of our listeners, that will sound outrageous. On the size I got, I usually pay somewhere between $6 and $7. It'll be like $6.59, $6.89, something like that.
Right.
So that was almost double. And so,
wow.
But it worries me that things are going to get dangerous out there.
It worries me that Canada's paying so much more money for toilet paper.
You're not going to, just...
That's what's worrying me.
Gas station down the street from us, $1.64.
Yeah, I don't know if that's good or bad. Actually, our prices have dropped. Not much here on the island, but the rest of Canada seems to be having a gas war. So, yeah. But, of course, not here. Not on the island. Yeah, well...
you got to pay for living in beauty, okay?
Yeah, I guess so. It's beauty tax.
Kind of like the taxes for the sunshine in California.
Yeah, there you go. You go.
Those people pay a lot of money for sunshine.
Well, there's about, what, 80,000 of them that don't pay much.
Yeah, that's true. Okay.
Yeah.
That's true, Bert.
Well, very similar stuff is going on here in Canada. I had a friend post this yesterday that she was at Walmart, and down the toilet paper aisle, two older ladies started arguing. And one grabbed her cane and hit the other one. So I says, well, I'm not condoning violence, nor am I, backing or defending the aggressor in this argument. However, have you ever tried to wipe your ass with a cane?
Yeah. Oh gosh, no. I mean, none of us want to wash, and we don't want to have to shower every time we go to the bathroom.
Yeah, exactly.
And for women, it's especially worrisome because,
Yeah. Well, I had to
There's a difference between men and women.
I had to go to the doctor yesterday to pick up some test results, just regular test results, right? And get some prescription refills.
Yeah.
So I go there as close to the appointment time as possible. I get ushered right through. Well, actually, the first thing through the door is hand sanitizer, right? Which is good. I walk straight through. They put me in a room. Doctor came into the private room, went over all the results, wrote my prescriptions. I grabbed my prescriptions and walked out the door. There was no waiting room needed.
Yeah.
So, why does the waiting room exist?
Yeah, I don't know.
If they can do it
to transfer germs.
If they can do it during a virus outbreak like this, they can do it all the time.
Absolutely. Now, I went to places. One was a doctor's office yesterday. And before I went in, there was, of course, hand sanitizer, but my temperature was checked.
Oh.
And I do think, although it's not foolproof, I think that's a great barometer for businesses that want to stay open. We talk a lot about the car dealership.
Right.
And I think, okay, well, you really shouldn't have to close down, but if you could make it by appointment only and you check temperatures before they come in, it just cuts down on the spread.
Right, exactly.
And I think what we need to do is be so thoughtful of other people. You wouldn't walk out with a gun and shoot somebody, especially a grandma.
Right.
Okay? So you must be thoughtful about this virus because in a way it's worse than a gun because the people have to suffer before they die.
Yeah.
And I think that a lot of young people are being selfish. A lot of older people are. You've got to understand that if you are unwilling to care about passing a virus on to a human being that it might kill, that you are probably a sociopath.
Yeah, exactly.
Okay? If you think gathering is okay, despite what the officials say, you're probably a narcissist or a sociopath.
Right.
Okay, I've got a kid that has type 1 diabetes, a very unusual seizure disorder. They say that people with seizure disorders, this is very bad for. He's only 30. Now, is it okay with me that somebody violates these orders and kills my 30-year-old son?
Right.
No. And these spring breakers that are violating the orders on the beaches, because they don't want to lose 1 week of spring break. Are you kidding me? You selfish little brats.
Yeah, I totally agree with that one. There's absolutely no need for that. I wish my son
had ever been well enough to go on spring break in his entire life.
Right.
And it just makes me furious. I got an aunt with cancer. I've got a husband with a heart condition. I don't want to lose any one of those people.
Exactly.
Because somebody else couldn't wash their hands, couldn't stay home for a couple of weeks,
right?
Couldn't stay out of a bar, whatever it is the hell they do. I don't know if you're on a lot of, I'm on a lot of lists, like local lists, businesses,
Right.
And there is a local business owner. He owns a bar and pub, like a pub, like they have food, and it's very British style. It's really one of my favorite places to go. And I have really liked the owner, okay?
Right.
He sends out this letter. It's the softest ass story I've ever heard about how you really need to come to his business anyway. He's got 35 employees, and no thought whatsoever to sick or old people out there that this might kill. First of all, you should have an insurance policy in place that pays you if you have to shut your doors for a crisis. Or you should save enough money that you can weather 3 months. They tell you that all the time. Okay? If you haven't, then maybe you should look at the way you do business. Okay? We're talking business owners.
Right.
On the same street, another business owner that I really love his place, he's done better planning. He has about the same amount of business. He's shutting down and redoing his plumbing. Okay?
Right.
If you have not planned well, or you have too many employees, that you can't afford, that's your fault. It doesn't trump people that are going to get sick and die.
Right.
And I do feel sad for people. Money's important. The government is going to put out a rescue fund. That will probably all be in place by midnight tonight. Okay? But if you are a viable business, instead of buying, Sea-Doos and boats, put away a little money for a rainy day. We live in a time since 9/11 where, excuse me, but shit happens.
Exactly.
Okay, by the same token, can you believe the damn airlines are already in trouble making payroll, and we're not even hardly a couple of weeks into this?
Yeah, exactly.
Why don't they save any more money than that?
Yeah, they seem to have no operating budget whatsoever. They just operate at the seat of their pants.
How does that happen?
Yeah, well, a lot of businesses are kind of taking the upper hand in this, and like for instance, my cell phone provider, they're not. If you can't pay your bill, you can't pay your bill. They're not going to cut services. They've lifted data limits for people as well. So
I've noticed that.
Yeah, they're in the provincial level as well. The government is promising relief for people with that have rent to pay, that live paycheck to paycheck, all of those things. Our government speaking of our government, that Trudeau's wife has coronavirus, right?
That's exactly right. And she is in quarantine, and he is in self-imposed quarantine.
Yeah, because I don't really think they're together anymore. They just something's not right there, and that's another show for another day, like you said.
Yeah.
But the government can take one step further in this if they need to, and they just might, and that is they take over public utilities.
Exactly.
And there's a few other things that go with this advanced pandemic outbreak or whatever you want to call it. But
right. Well, that's exactly what it is. I mean, I guess there's a lot of names you could put on it. President Trump, I just finished watching his news conference. He called it a war with an invisible enemy. And I think that's true. It's a war. Right. And if you watch, I don't know, remember back in the 90s and pretty much the 80s, Discovery Channel and History Channel would have a lot of shows about, prophets, predictors, whatever you want to call them, like Nostradamus, Edgar Casey. And, every one of those guys, those seers, you might say, said, our greatest enemy was going to be a laboratory-generated pandemic.
Okay.
And I always kind of believed that was true.
Well, it certainly almost seems like that because coronavirus is patented. So it is a man-made virus. However, variants of coronavirus have been around for a long time, which I did not know about.
Really, the common cold is coronavirus.
Yeah, exactly. So I think it was 15% of the flus, like season to season, were coronavirus. So it's just that this new variant is a little bit dangerous, but by any means it doesn't have the kill rate that something like Ebola or SARS had. It's just spreading dangerous and a 2-week incubation period.
Well, and let me tell you this, I'm going to put a little caveat in what you just said. It appears that the information we got out of China was a big bunch of hooey.
Right.
Okay? And one of the big lies seems to be that young people now, like millennials, were asymptomatic for the most part. They didn't have very bad symptoms. They were much like the common cold. Well, in the news conference that just took place, they said, whoa, wait a minute. This looks like something that China was not completely honest with us about.
Right.
Okay, because in Spain and Italy, that group is getting hit just as hard with death rates and hospitalizations as the older people.
Right.
Now, 9 years old and under, they're doing okay. We've only lost one in the world. And that was probably a very sick kid that contracted it.
Exactly. You can't classify everything as age because as people get older, they have more diseases, more health issues. So it could be those that are contributing, not the fact that they're 80 years old compared to a 20-year-old.
Exactly. So the death rate is looking pretty high. Now, I'm not saying as high as Ebola.
Right.
But it might surpass SARS. Okay, that we still don't really know, and that's a lot of the misinformation. We have some very good information from South Korea,
right,
and of course Italy and Spain and Germany. Those are places that are being hit really hard. Now, they did also explain that our numbers are not going to be reliable until next week. The reason is we're doing a whole bunch of testing right now, and so it will be imbalanced. We may be testing people that came down sick 2 weeks ago.
Right.
So we're going to look like we have a big bunch of influx.
Right.
Because we have better testing in place. For example, our county is particularly bad. We're the worst in Missouri. We got a drive-through lab. On Monday, we were in that first group, and we're in a town of like 160,000.
Right.
So we're, but now most of our cases seem to have come from Australia.
Oh.
And
okay.
Australia has some of the lowest amount of cases.
Yeah.
So there's so much conflicting information.
Yeah.
That we, that new stuff, new information, new charts are being built every day.
I don't think you can accurately take an assessment because you're not testing everybody. We're not here in Canada.
No, you can only test people that are symptomatic, and a lot of people won't go.
Right.
I mean, unless they need emergency help.
It's already...
They don't go, for one thing, because they really don't know.
Yeah, it's put a big strain on our medical system for sure, having the amount of tests go through right now.
And we are getting a lot of nurses and doctors infected because we don't have the proper respiration gear.
Right.
Okay? A lot of masks and stuff, that we're even going to take from the military. The military is going to give the medical near mass, but they're one-time uses. Well, and we only have 5 million. Okay, one doctor can go through 100 in a day in an emergency room.
Yeah, exactly.
That is not going to last long.
No.
On the same hand, we have possibly about 200 nurses infected.
Wow.
We have a couple of doctors that are on their deathbeds in Florida. They were a couple of the first responders.
Wow.
So it is very bad, and we cannot afford. We're already in a shortage of doctors and nurses, much like you are up there. I mean, we have been for years.
Right.
You know, we need more doctors and nurses everywhere.
Yep. I totally agree with that.
It is very, very bad. Now, how long is this going to be a disruption? You know, they're asking for everybody to stay inside so we can contain for 15 days.
Right.
At first, we kind of had the feeling and the understanding that we were going to have this under control and be on the upside by the end of April. They're now saying possibly the end of July or August.
Oh, no.
That is very bad for a lot of reasons. You know, you start adding in issues, not only financial issues, but you start adding in mental health issues. We know one thing. When people are separated from society, they start getting bad mental health issues.
Right.
The deadliest, you know, disease we have is loneliness. And we are leaving a lot of our seniors, their families are not able to visit them. You're going to talk about a lot of indirect death. That is like not necessarily like you're dying from the exact disease, but you're a secondary component.
Yeah, you don't want to live like this. You lose the will.
Exactly. Right? Exactly. So we don't know what the disruption time is. We've got to hope that everybody contains and we can get a hold of this in a few weeks versus a few months. Now, I want to bring up one other thing, and this is something that in Canada we always differ from the United States. It's a cultural thing. Okay, we only have so many hospital beds. In the United States, we have some 900,000 hospital beds.
Right. The
best I can tell now, because our numbers are crazy and the death rate, out of the 330 million people, we could need as many as 30 million beds at one point.
Whoa.
Okay? What are we going to do with these people? We are going to have to make those life and death decisions that people like me say that that already has happened in Canada and the UK, where you guys have to make those decisions more than we do. Okay, what is best? What is ethical? What is right? You say, okay, everybody under 50 gets priority, okay, to health care.
Right.
Or do you say, who can benefit the most? Okay, because you might have a heroin drug addict with cancer that's 45 years old and a guy 65 who's in great health. Theoretically, the guy that's 65 has a better chance of making it than the 45-year-old.
Yeah, those decisions aren't made in the medical system here in Canada. The decisions are made based on which patient needs it the most.
But how do you make that decision? By age or
the doctor
who's going to make it?
The doctor makes that decision. Yeah, the doctors are sworn to give the utmost care and always try to make the person better. They're sworn to take that oath, and our medical system doesn't mess with that whatsoever. Often you get conflicts, like the nurses want to deal with patient comfort over the patient healing, like at the end of life kind of thing. And
right.
So at those times there can be a conflict, but who are we to say what is right or wrong?
Exactly.
So, there is a conflict there. However, I guess it depends from hospital to hospital or facility to facility, what the relationship is between the doctor and the nurse. But the government doesn't really stick their nose in saying, no, you have to give priority to people under 50. That's never going to happen here.
Well, it certainly has happened in the UK. I mean, we saw that with baby Charlie and a few other cases. But there needs to be some sort of guidelines for these healthcare professionals, because that is a heavy weight. I mean, there has to be guidelines, and I personally believe that it should go on the viability. Who is most likely to benefit from the care? And that's not always determined by age.
Right.
So, and I'm speaking as a mother of a very sick kid. I still think that we have to have some sort of guidelines, and it has to be as ethical as possible. We're deploying some ships with 1,000 beds each. They will take care of triage, leaving the hospitals for the coronavirus. I thought that was interesting, that the ships will not take care of people with coronavirus. They will instead take care of people with emergencies.
Right.
One of them is going to be placed in the New York harbor, because New York is being tested. Their whole system is already being tested, and they need more hospital beds.
Right.
We just talked about how many beds are available in the United States. In fact, how many ICU beds are available is very, very small.
Right.
So that's problematic.
I don't think that differs much from here as well. We just don't have the capacity. Usually our hospitals are pretty packed, and you're waiting for that.
Exactly.
So.
Gatherings have been pretty much, they're all stopped. I mean, for the first time, the Kentucky Derby will not run the first Saturday of the month, or at least the first time in 75 years. They pushed it all the way to September.
Right.
My son's wedding, we are considering, it was supposed to take place June 7th. We are considering, because you have to put a lot of deposits down and you will lose that money.
Right.
We're thinking of pushing it till September. Be careful with dogs. Dogs can get a mild form of the coronavirus, therefore they can pass it along. So they do have some dogs that have tested positive. If you owe taxes, they would normally be due April 15th. The federal government has now delayed that by 90 days.
Right.
Like you said, there are a lot of companies that are deferring payments. Foreclosures in the United States and evictions have been halted till the 1st of May. I have a feeling that'll probably be extended. They will not shut off utilities in most places in the United States if you do not pay. A lot of phone companies and credit cards say, call in if you're having trouble. We'll make it okay for you. To pay later or ship a payment, whatever.
Right.
Stock trading about an hour ago was stopped for the 4th time. The stock market was losing so much. We now have eaten up every bit of gain that we made during the Trump administration.
Right.
They just now suspended all non-urgent surgeries, meaning they want to keep medical supplies freed up. It's not really space yet that had them making this decision. They're just saying, we don't want to use up the supplies.
Right.
We may need those medical supplies. Air travel, I'm going to predict that after this bill that the president presented goes through the Senate sometime tonight, I have a feeling domestic air travel will be halted. They just had to shut down Chicago Midway Airport because the whole control tower just contracted coronavirus.
Oh, wow.
They don't have anybody in the control. Who cares about Biden and Bernie when you got coronavirus? I mean, who gives it? I mean, it just doesn't matter right now.
Right.
But it does look like Biden will be it. Why do the rich get tested quicker than the poor? That's a question out there. All these sports figures, these actors, they're getting the test, no problem. Okay? What the hell is that about? I mean, and they're protected. They're probably not around as many people as everyday people. I mean, that doesn't make any sense. Amazon is hiring another 100,000 people because while ordering, we don't want to leave our houses. That leads to another thing. They say, well, get to-go orders from your favorite restaurants so they don't go broke. And that's a great idea. Except, how do we know that guy in the kitchen is okay?
Yeah, exactly.
I mean, I agree. Someone said, if you've got a favorite restaurant and you can afford it, go buy a gift certificate to use when this is over. So that restaurant can build up some cash. At the same time, give people incentives to buy those gift certificates. Give them a free appetizer later on, or, buy $20 worth, get 25 or something. Do whatever you can. Most companies are talking about non-contact deliveries, where you pay over the phone or something, or your computer with your credit card. They set it on your porch.
Right. Slip it under the door if it's a pizza.
Yeah. So, these are strange times. It's scary. It's sad. It's lonely. Lonely. Very lonely. I mean, I work from home. I stay. I do a lot of things at home. But the minute you tell me I can't go out, I am suddenly more lonely and depressed.
Right. Well,
because, on a daily basis, I do most everything from my home. I live in practically, my house has everything I need. I don't go out, you know what I'm saying?
Well,
I like to go out.
My story's a bit sadder because right now the self-quarantine is basically not much different than my regular life.
That is a little sad. I go out more than that, okay? But on a normal day, I wouldn't think much about not leaving if I didn't have to. I leave most days and go someplace. But I stay home a full day a lot of times. Now that you tell me I can't, I'm like a little freaked out. I'm depressed. Monday I just cried.
Yeah.
I'm not a big crier, but, it's just so sad, so scary, and you don't know what to do.
Yeah, I totally agree there.
Yeah, and we don't always agree, but life's a journey, and these are tough times. Godspeed, stay healthy. Thanks for listening. We appreciate it. We're getting a lot more listens now that everybody's quarantined. We appreciate that. But we would rather just earn them, not have to quarantine people to get them.
Exactly. Godspeed, Grace, and everyone. Thanks for listening.